welcome back to my channel. I'm so glad that you're here, and today we're going to be talking all about breast refusal or breast strike, nursing strike, whatever you know it as. I have gotten so many messages, emails and questions over the last few weeks of these poor mamas who just don't know what to do because their baby, who was previously nursing really well, has now just completely refused the breast. And it's something that I deal with a lot in my lactation consultancy practice. So I thought today that we would dive into some of the common causes for a nursing strike and what my top kind of tips would be for getting over that period of refusal. If this is your first time being here, welcome. Thank you so much for coming to join our little family over here. My name is Kitty. I'm a registered general nurse. I'm also a lactation consultant, birth and postpartum doula, as well as hypnobirthing instructor and antenatal educator. And I'm also mama to two sweet boys and a bonus mama to my stepdaughter. So over here, we talk about everything from trying to conceive, pregnancy, birth, and breastfeeding. If you're interested in getting some freebies, some downloads, or joining my e-course, make sure and check out my website that I will have linked in the description box down below. So one of the biggest questions that I get for those mamas who are struggling with your baby not going to the breast is, how do I know the difference between my baby naturally weaning from breastfeeding themselves versus a baby who is just going through a period of refusal of the breast? And for me, I always come back to the question, how old is your baby? Because it is very, very unusual, or certainly uncommon, for a baby who is under the age of 1 to naturally wean from breastfeeding. So if your baby is under 1, you can almost be assured that it is a breast refusal situation that you are going through. And please just sit tight, try all these strategies that I'm going to mention later on in the video, and soon you'll be able to make your way back to the breast. So when it comes to the causes of a breast refusal or breast strike, they are either physical or environmental. And typically, if I see you in a consultation setting, I will go through a list of questions, get a really detailed history from you, just to get a picture of how the period, both before and now during the strike, has looked when it comes to time spent at the breast. I'm going to go through what some of the typical physical signs are, kind of go in detail as to why those might impact a nursing strike and your breastfeeding journey overall, and then we'll talk a little bit about the environmental factors that might come into play. So in typical Kitty fashion, I'm just going to go through the list that I've actually got written out here, because we all know, mom brain, I know I'm going to forget something. So when it comes to the physical causes and the things that might impact your baby not wanting to go to the breast, we start from the very, very basic things. So things like an ear infection or a cold. If a baby is very bunged up, or indeed if they have an ear infection going on, it can mean that their time spent at the breast is really uncomfortable. So that can cause them to go on and off the breast, sort of pulling at the breast, things like that. The next one would be reflux disease, and this is something that I see less commonly, but as you can imagine, if our tummy contents are coming back up, they are very acidic and they are irritating the lining of our throat. And for babies, it means that when they're swallowing at the breast, for some babies it can mean that it is very soothing, and for other babies that reflux disease can actually cause them to have discomfort when it comes to feeding time. So generally, for the most part, reflux is more of a laundry issue than anything else. I will link one of my favorite books by my fellow IBCLC colleague down below that details a little bit more about reflux disease and a little bit more about how we can best manage it and when medications are appropriate and how they work and things like that. If you feel like your baby is struggling with reflux, do check in with an IBCLC to make sure that you're out ruling any breastfeeding issues. And check out my video that I have on fast milk flow and overproduction, because they are generally interlinked. The next one then that we talk about is, certainly outruling, breastfeeding issues, but food allergy. And food allergy is something that, really can come up as something, again, less commonly so, but something that really needs a specialist eye when it comes to a baby who is refusing to go to the breast. Oftentimes we will see things like maybe a rash, or babies going to have very interesting stools. We also look really closely at babies' weight gain or weight loss, making sure that they are going nicely on their own growth curve. The next one then is injury. So injury to mouth or to body. So for instance, most recently I've come across a baby who has refused the breast after having a tongue tie released. So as you can imagine, having something very sore in your mouth like that, a wound in your mouth, it can mean that not only from the negative maybe experience of having the tongue tie released, but also post procedure there can be a degree of soreness that can mean babies don't necessarily want to feed or won't feed as readily as they had previously. Again, we'll talk about kind of how to get over this in a minute. The next one then is medical procedures. So things like in babies' immunizations, if your baby is on any specific treatment, they might have just discomfort around the remainder of their bodies, or they might be a little bit fussy. So my babies always get, like, the night after they get their immunizations, they are always really fussy on and off the breast the whole night, high temperature related to it, and just really uncomfortable. So we all know that breastfeeding isn't just about the calories, right? It's about thirst, it's about comfort, it's about reassurance, about thermoregulation, it's about, just wanting to be and have that kind of that comfort. So when it comes to babies being uncomfortable, they want to go to their place of comfort, their source of comfort, but they're uncomfortable there, so they pull away. So it's about kind of finding what the cause is. The other common cause is just teething. So babies who have a really sore mouth will find it hard to go to the breast, and they will struggle with kind of maintaining a sort of a long duration of feeding. Babies who have thrush, again, soreness in the mouth. So it's not just a sort of thick yellow furry coating on the tongue. It's actually very uncomfortable for babies. So they are always things that we will outrule during a consultation. And then the last one that again I see less commonly would be a product reaction. So it might be you've got a new detergent, it might be you've been using a perfume or a spray recently that is impacting your baby. They're really sensitive to smells, particularly in those early days. That's how they actually find the breast. That's a story for another day, but looking back on kind of your history of the last few weeks and trying to pinpoint when that breast refusal first came about can be really helpful. Now let's talk about the environmental factors. So environmental factors always come into play as well. It's not just about the physical. So when we come back to kind of the different things that might be going on here, I always ask mama what their day looks like, what a typical 24 hours of nursing their infant looks like, and how they approach that. The answer to that question tells me a lot about the way that they've been parenting and the way they've been feeding their baby. So oftentimes I see these mums who've been doing scheduled feeds, and these scheduled feeds can actually cause a nursing aversion or a nursing strike to occur. So we always kind of come back to understanding our baby's needs, looking what their cues are, and coming back to watching the baby as opposed to watching the clock. The next thing is overstimulation. So a baby who has been, up and about, maybe doing loads of tummy time, maybe then had a bath, maybe then, been in the car or on their bouncer, they're going to be really overstimulated, and those babies need to kind of come back and regulate themselves and with support. So a baby who is really highly stimulated will often find it hard to then sort of come back to synchronizing their suck, swallow, breathe sequence. So for a baby who's really overstimulated, you're talking about removing stimulus. So things like dark room, maybe getting into the bath with baby, coming back skin to skin. We'll talk about more ideas in a minute. The next one then is a major routine change. So oftentimes I will see a breast refusal with things like baby starting to go to a childminder maybe, or they're going to kind of like a nursery while mum has gone to work, so a big period of separation maybe, or if baby and mum and baby have been either of you have been unwell, that can also kind of cause a period of nursing strike. The next one then is a sort of a strong reaction to baby biting. So this is for a baby who's maybe that little bit older, they've got a few teeth, and sometimes it's something that we just can't help. And I know certainly I do it every now and then. If Archer was out the first time he bit me, I had such a strong reaction to that, and it was only lucky that I was able to kind of compose myself and he was able to continue feeding, that I didn't, by sort of no fault of my own, create a negative association with the breast. So trying your best to instead have a really calm response if your baby does bite. And then the last one is probably the most common theme that I see with breast reversion, and that is a flow preference. So that is if you've been giving if you're doing combination feeding, or if you've just been giving sort of topping up with a bottle, that oftentimes the way that it is given means that baby doesn't have to work as hard to remove the milk from the bottle as they do with the breast. So when we think about a baby who's removing milk from the breast, they have to use all these lovely oral facial muscles, whereas a baby who's feeding from a bottle, they just have to use their cheeks. And if there's a very fast flow from that bottle, babies are very clever and they realize, oh, I don't have to work that hard. This is fantastic. So when it comes to being offered the breast versus the bottle, they will always let you know loud and clear that it is much easier for them at the bottle. So if you are combination feeding, or if you are looking to incorporate the use of bottles in your breastfeeding journey, make sure and touch base with an ibclc, or check out my Instagram highlight for a paced bottle feeding tutorial. Okay, so now we're going to talk about what we can do to get us over this little hurdle. And I've got 2 rules here. No matter how long the nursing strike goes on, while we're trying to get to the bottom of it and do a little bit of detective work, we want to protect our supply and feed the baby. So you're thinking about maybe alternatives to bottle use, so maybe cup use, spoon, syringe. You're talking about feeding the baby so that they are happy, but maintaining our milk supply. So that might mean doing a little bit of pumping for the times where our baby maybe doesn't take a full feed at the breast. But now we're going to talk a little bit about the more specific things that you can do to help your baby get back to feeding at the breast without any problem. So tip number 1 is to remember that we don't want the breast to become a battlefield. We want to keep time at the breast fun and playful. So looking into your baby's eyes, playing with them, giggling with them, counting their fingers and toes, creating that lovely engaging communication and contact during the time at the breast, as opposed to forcing our baby to go onto the breast. After 5 minutes or so, if your baby's just not playing ball, feed them in your alternative method and try the next feed. Tip number 2 is something that you might have only associated with those early days of breastfeeding. And in fact, it's something that is beneficial the whole way through infancy. And that is time spent skin to skin. So skin to skin not only has a whole host of other benefits, but it can release hormones both in you and in baby that can help baby go to the breast. Tip number 3 then is what I find to be the most effective, and that is the use of your baby's sort of semi-sleep states. So what we're talking about is those times when they are just falling asleep for their nap or just waking up from nap time. So to make the most of that time when our babies can feed in up to 90% efficacy in that semi-sleep state, you're talking about making sure that the breasts are freely available during that time. So maybe that means rocking your baby in your arms to sleep with your breasts free. Maybe it means mastering nursing your baby in a sling, or simply just getting back into bed with your baby and co-sleeping with them during that time, during nap times, during bedtimes, making sure that you're doing it safely, of course, following your Safe Sleep 7, but making sure that you are utilizing that time can be a fantastic way to just bridge the gap and get back onto the breast. So my next tip is to trigger immediate milk flow. So sometimes for those babies, particularly those of them who have developed a flow preference when it comes to bottles, will be hesitant or frustrated to work to transfer milk at the breast. So by giving them more bang for their buck and making it a little bit easier for them when it comes to milk removal at the breast, we can start that kind of the flow of milk a little bit earlier. So you can do things like a little bit of hand expression or a little bit of pumping just to the point of letdown before offering your baby the breast, or you could instead use a technique whereby you are using a dropper to keep a consistent flow of milk so that your baby can kind of reassociate the breast with that lovely milk and that lovely positive time. So just in the same way that you would not like to work hard or learn a new skill when you are ravenously hungry, our babies are the same. So when it comes to creating a positive association with breastfeeding and getting over that nursing hurdle, let's talk about making sure that our babies aren't ravenous first. So that might mean feeding with them with that alternative method first, or simply offering the breast more regularly than we normally would have. This next tip is a really clever one and something that we think less about, and that is just using a bait and switch technique. And that means, simply put, that for a baby who will feed very well from the bottle but has now decided they don't want to go to the breast, that you would Feed your baby in a breastfeeding hold or breastfeeding position with the bottle. Once they have started to actively swallow, that's when you will swap. Take the teat out of their mouth and offer them the breast. The reason this can work really nicely is because swallowing leads to more sucking, which leads to more swallowing. So while they're in that pattern and that rhythm, you're more likely to be able to be successful when offering them the breast when they are actively in that mode of suckling. And so we're nearly at the end now, but this one is something that I would recommend using a little bit of guidance from an IBCLC around, and that is the use of specific tools. So things like a supplemental nursing system that you can use as a little tube at the breast, nipple shields, or a bit of breast shaping to help encourage our baby to actually latch on can all be really, really helpful when used in the right guidance, making sure that they're the right fit for you and that you're using them in the appropriate way that isn't going to kind of cause you more damage or cause your baby any injury. But they can be really helpful as sort of a little step to help you get over that hurdle, but making sure that you're touching base with an IBCLC is always really. So the last tip that I would have is kind of 2-in-1. It would be about kind of avoiding pacifier use or soother use, if that's what you call them, during this time. And the reason is that we want to be utilizing and making the most of our baby's energy for suckling, so that we are offering the breast and trying to kind of, I suppose with soothers, sometimes they can bridge a gap between feeds when we could otherwise be offering the breast. So using the most of that time that we can. And the last one that I forgot to mention was about using motion to our advantage. So using things like rocking, maybe it's bouncing on the side of a bed with baby in your lap. Maybe it's offering the breast when baby is in the sling, if you've managed to master that yet. But all of those can be really, really helpful, and making sure that you're getting to the bottom of the cause. So if, for instance, you've been trying all of these, but you haven't been able to figure out what the cause is yet, going through that list and re-going through it and touching base with somebody who knows what thrush looks like, knows what fast letdown looks like, knows how to assess a baby for tongue tie, knows whether your baby is or has been actively moving milk from the breast and whether or not they're doing well in that way. So if you're looking to talk to an IBCLC, make sure and send me a little message through my website today, or consider touching base with a lactation consultant who is in your area. I hope you have the best of luck, and remember that while nursing strike is extremely stressful, I've never been able to, not get over it with a client. So it's something that's not forever. It's stressful, but feed the baby and continue to support your supply and you'll be fine.